Son, born in 1991, has a slight form of autism called Asperger's. But it seems, and again, when I was practicing law, and also when I was in Congress, parents would constantly come to me, and they'd bring me videotapes of their children, and they were all around the age of my son or younger.
The generation,
so something happened in 1989.
Exactly. The generation, what happened was the vaccine schedule was increased. We went up from receiving about 10 vaccines in our generation to these kids receive 24 vaccines.
2005, Morning Joe, a very sympathetic conversation with RFK Jr. at the time, open at that time to RFK's concerns about health and vaccines. And now Democrats and the media are in a state of disbelief that RFK, who has crossed the political aisle, should be nominated to lead Health and Human Services. Pleased to bring in right now two experts on this, internist at Custom Care Medical and good friend of the program, Dr. Frank Conchechesa, and Chief Scientific Officer at the Wellness Company, Dr. Peter McCullough. A pleasure to have you both with us.
Great to be here.
You know, didn't age well for Morning Joe, but of course they're, you know, all over the place now that Trump is reelected. Dr. McCullough, obviously RFK Jr. As Health and Human Services Secretary would be looking at things with a more critical lens, which is what Americans, I believe, voted Donald Trump in to do. Your take on some of the good things that he could, you know, be looking at, whether it be the NIH or whether it be making Americans healthy again.
Robert F. Kennedy, remember, you know, if successfully confirmed, would lead Health and Human Services, which has over a dozen sub-agencies, big ones like CDC, NIH, FDA, HRQ. So he'll provide broad leadership, but I think his philosophy is of one of inquiry, being data-driven, and to, you know, seek to improve the outcomes and improve the health of Americans. And I think he'll do that working through issue after issue as he assembles his team of physicians and scientists and administrators in Washington.
You know, Dr. Frank, you know, RFK has talked about food manufacturers, the dyes, the additives. Europe has them banned, and they have better longevity, and they spend less on health care. I mean, wouldn't this be something you would think everyone would embrace? It's not really left or right. We all have, you know, concerns about living better, older, and our kids.
Absolutely, Bianca. You know, I was actually talking to my wife earlier today about this, and she said to me, who wouldn't want healthier food? Who wouldn't want somebody to look into the stuff that we're putting into our food, onto our spraying, onto our crops? And if other countries have seen fit to ban these products, why are we still doing it? Who wouldn't want the truth about these things? And listen, if it turns out that these things are safe, then that's fine. But there's a lot of evidence to say otherwise. So again, why wouldn't we look into these things? And we're putting these into our children's food, and it makes no sense not to pursue this. Excuse me, I think we should let RFK loose, and I think we should see what he can do.
Let him loose. That's what Trump said. And, you know, big pharma stocks were tumbling the day the announcement came. Dr. McCullough, in the early stages of COVID, President Trump was still in office, and there was a discussion about ivermectin and what it would do. And this is surgeon and researcher. We want to play a clip from Dr. Kathleen Ruddy, who talks specifically about ivermectin.
Ivermectin, as I said to you, is safer than a sugar pill. You'd have to take a lot to make yourself sick. Ivermectin is so non-toxic that if you gave someone, you know, ivermectin every day, if you did a randomized trial, these people are getting ivermectin every day and these people are getting sugar pills every day, my prediction, test it, see what happens, would be that the people who are getting the sugar pills would end up having more harm, at least, you know, spikes in their insulin level, than the people taking ivermectin.
Well, you know, the media was beside themselves, and some Democrats saying it's horse dewormer. You lived through this. What's your take on where we stand now? And I guess since Elon bought X, we won't see as much censorship when it comes to statements like this anymore.
We should never have censorship of vital breaking information on treatment in the setting of a pandemic. And it turns out information was suppressed on nasal sprays, over-the-counter products, hydroxychloroquine, ivermectin, corticosteroids originally, colchicine, and we can go on and on. You know, with ivermectin, it turned out to be one of the most versatile, useful drugs supported by dozens of studies. The one to cite is the ICON study, you know, done in Florida, showing that ivermectin, when used through the continuum of care, reduced mortality in COVID-19 in 2020 by 50%. Now, we never had large prospective double-blind randomized placebo-controlled trials. However, why not give people the chance? I mean, every hospitalized patient should have received ivermectin in addition to all the other interventions. I think we could have dropped mortality for COVID-19 admissions.
Incredible. Let's ask you both about this. Long COVID, it's something people are dealing with today. What do you think is the best practice for people who think they have long COVID? I'll start with you, Dr. Frank, and then you, Dr. McCullough.
Great. Bianca, I just want to add one little thing about ivermectin, and I know
Yes,
Dr.
please.
McCullough is aware of Uttar Pradesh early on in COVID in India, a province that didn't have access to a lot of other modalities, but they did have ivermectin. They were using it to treat river blindness there, and they virtually eradicated it in that province. And we should have looked at that, even though we didn't have randomized data on it, controlled study. Observationally, it seemed to have worked, and we should have taken it a little bit more seriously. And as far as long COVID, there's a lot of studies going on, but it's very hard to parse out, was it the infection of COVID itself, or is it potentially the effect of the mRNA vaccines that could have led to long COVID in and of itself. So it's hard to parse these things out. It's hard to diagnose. There's no specific test for it. And there's lots of other things that can cause the fatigue and the brain fog and of the symptoms that go along with it. So not to say that it's not an issue and that's not a problem. It's very difficult to diagnose. And once you do diagnose it, there's really no treatment for it. So it's sort of a conundrum that we're going to be dealing with for a long time.
What are your thoughts on it, Dr. McCullough, in our final moments here?
Our analysis here in my office in Dallas is that the long COVID syndrome is due to the spike protein, the retained spike protein, or the spine on the surface of the virus. It's not broken down by human enzymes very well. So we've published now 2 papers proposing that we use 3 natural products, nattokinase, bromelain, and curcumin in combination to aid the body in degrading the spike protein. We have now, a first peer-reviewed publication demonstrating success and have thousands of patients under observation. So we think that should be a base. And then on top of that, for some of the chest syndromes, we add colchicine, which should be used in the case of inflammation in the chest, now broadly approved by the FDA for prevention of atherosclerotic cardiovascular disease events. Anyway, autoimmunity is typically a call for hydroxychloroquine. There has been some observational success with using a low-dose 7-milligram nicotine patch to improve mental clarity and post-exertional malaise.
Well,
so it's a difficult syndrome, but we're making inroads.
Yeah, it sounds like you are. It sounds like there's information that people can access and find more about. You just gave us some of it. So a pleasure to have you both. Thank you for filling us in.
Bianca, 5 seconds. I just want to say that I've actually taken the Dr. Peter McCullough detox regimen for spike protein. Dr. McCullough, it's been a real honor to be on with you. I've been following your work since the beginning of COVID, and I thank you for all that you've done.
Thank you.
All right, thank you both. Dr. Frank Contachessa and Dr. Peter McCullough, appreciate you both for the information.